Hello, good morning. My name is Emil Malferrari and this is my knee examination video post the GP13 conference. So we start by doing the look, feel, move and special test order of things, but obviously we need to combine some of these along the way. So I normally, when the patient comes in, start by doing a general inspection. First letting the patient stand straight to your anteriorly to the front. So here I am looking for her stance, her gait, if there's any discrepancy, any pelvic tilt or asymmetry, any obvious leg length discrepancy at this stage, and also importantly the alignment. So I normally check the alignment by making a line middle of the thigh, the patella or the kneecap, and then the ankle. So middle of the thigh, kneecap and ankle. So here we can just see a subtle valgus deformity there, I think, very subtle one. And here there's an arc here, so there's no obvious fixed flat foot deformity there. Here we can also see better the muscle bulk. So can you tense your muscle here? Yeah. So there seems to be good muscle bulk here, and there's no sign of any atrophy or anything like that, so that's good. Anteriorly also we can see, just relax now. If there's any obvious swelling around the knee joint, it would normally be apparent on the medial aspect of the knee here, where it is the most dependent part. But here we can see a nice sulcus or a groove, which indicates that there probably isn't a effusion or a big effusion there, because if there is, then that will disappear. Next, we would let the patient examine the patient from her side, from the lateral side. So if you could just face their lane, so we can look at your side, feet together. Okay, all right. Okay. Now here we can see a good alignment here, and there is no apparent hyperextension of the knee joint, so that's good. Now we ask you to face back of the camera, so face there. Okay. Now here again, it's good to see the back of the feet, the popliteal area. So the popliteal crease is nice, equal and symmetric. There is no lumps or mass or any cyst that we can see. Here you can see either the Baker's cyst or popliteal aneurysm of that sort. And then we can always do again the alignment, middle of the thigh, knee and ankle. So as you can see here, there is a valgus deformity there. Okay, so we ask again the patient to face the camera, please. So after looking, it's then good to do a test of function. So we ask the patient to squat. Okay, squat, just squat until here, like that. Okay, stand up. Okay, was there any pain in the knee there? No. Okay, so normally if there's pain, you could then suspect, query, is there a meniscus there, things like that. Now we then ask the patient to jog on side. That's fine. No problems there? No. Okay, that's fine. And how about you hop on one knee? Yeah. And then the other side? Okay. Any problems there? Okay, that's good. We then test the mobility of the patient. So having the patient walk to here and then back there. Yeah. And walk there. So obviously we're looking at the patient from here. Okay, going back. Gait looks normal and there's no obvious varus thrust deformity. So at this stage we would then proceed to the patient lying down, please. And sorry, I just need to adjust my camera. So there's no assistant here, so I'll just need to make use of this one. Okay, all right. So again, I'm doing the look, feel, move order. So here we can have a look for any leg length discrepancy. So pelvis is squared and equal, heels together. There's no obvious leg length discrepancy from I can see. Muscle bulk is normal. There's no atrophy. It is symmetric. There is also no obvious joint effusion there. Now it's also good at this stage to then do the feel part of things, especially to test for effusion around the knee joint. So normally we implore two tests. One is the sweep test or the bulge test, which obviously applies only to small or medium effusions. And for bigger effusions, we do the patellar test. So in the patellar tap test for big effusions, we empty the medial side, press the suprapatellar pouch, and because of the too big an effusion, you can actually push the patella downwards, and then it ends up with a tap as it touches the femoral condyle. But in general, for small and medium effusions, we do a sweep test. So for the sweep test, we empty the medial compartment, compress the suprapatellar pouch, and then normally we then sweep the medial lateral component. And as we do that, if there is an effusion, there is a fluid wave here, or it fills back up. So if that's positive, then that indicates small effusion. For medium size effusion, there is ineffective sweep, because as soon as you empty the medial compartment and press the suprapatellar pouch, before you even sweep the lateral, the fluid already goes back to here. So then we then proceed to the other part of the examination. As per Dr. Meyer's video, we can sometimes then grab both feet there, and from the side look for any obvious hyperextension. I don't see any at this stage. Then we go after the look, then the feel. So with the feel compartment, one of the good things obviously is to palpate around the joint. So in this position, normally sit down. Also, before having all of those feel, at this stage, it's good to note the position of the tibial tuberosity and the patella. So in this position, the tibial tuberosity is anterior than the patella, which indicates that it's normal, because in some stages, if this tuberosity is posterior, then it may indicate a posterior cruciate ligament laxity. It sags towards the posterior side, but in this case it's normal. Also, the position of the patella, it's sort of like looking over my shoulder, which is normal, because if it faces upwards to the ceiling or a bit lower than the shoulder, then it might indicate a problem with the patella or its ligaments. So we proceed with the palpation now. So starting at the medial side, I am palpating the medial edge of the patella. There's no pain there, there's no tenderness. The patellar tendon, the tibial tuberosity here, the medial femoral condyle, the anterior joint line, and going through the medial joint line. Is there any pain there? No, that's good. So to demonstrate then the lateral palpation, we go here. So again, starting at the palpating at the lateral patellar margin, patellar tendon, tibial tuberosity, lateral femoral condyle, head of the fibula, lateral joint line,